Gingell is absent with notice. Gershenson.
Here.
Jackson, McGilvray, and Nelson are all absent with notice, and Cavell is on his way. Joliet,
Here.
Lubes,
Here.
Woodward.
Here.
We have not reached a quorum yet.
Thank you. So we'll move forward with Pledge of Allegiance and the first public comment, and then move to our presentation first until we have a quorum. So please join me in rising for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We'll move to our first public comment. Is there anyone from the public wishing to speak to items on the agenda today? All right, public comment is closed, and we will move down to our presentation, which is by Oakland County Youth Assistance. So I would invite Liz to the front of the table to begin a presentation. And youth assistance is near and dear to all of our hearts, so welcome.
Thank you, thank you. It's my pleasure to be here. My name is Liz Sismadia. In July, I had the good fortune to become Chief of Youth Assistance after Mary Schusterbauer, who's probably a name that's familiar to you, retired after I think close to 40 years of service with our program. So in July, I assumed the position as Chief. Coming out of a pandemic, there was lots to do, brought staff back full-time, started to engage clients face-to-face, programs really kind of hit the ground running, so it's been a very busy first 6 months here, but wanted to kind of give you just an overview of who we are and all of the fantastic things that our hardworking and dedicated staff across all 26 school districts are doing on a daily basis. So, just quick show of hands, I know there's some familiar faces, familiar to some degree with youth assistance.
Oh, no, we're familiar.
Yeah, I'm sure. Well, youth assistants, this year we are celebrating 70 years of service to the citizens here in Oakland County. So back in 1953, it was Judge Arthur Moore and a gentleman who was the school superintendent of Hazel Park School Districts, a Dr. Wilford Webb, that decided we need to start keeping kids in the classroom and out of the courtroom. So they put together a model that is still the model that we use today that combines primary prevention with secondary prevention-based services. In a nutshell, what that means is that we provide casework and community org to fulfill our mission, which is to strengthen families and communities, to reduce the incidence of juvenile delinquency, and prevent child abuse and neglect through community involvement. We have a unique model in which the circuit court has combined with the school districts and the local municipalities across Oakland County to provide nearly a combined $1.4 million for operational expenses. The court, the family division of the circuit court provides the caseworker across all school districts, and then it's the municipalities and the school districts that either provide cash or in kind, and it's sort of dependent on the local communities what that exactly translates to. But they often provide like the secretarial support, an office space. Most of our local offices are located within school districts. There are a couple that are located maybe within like Novi for a long time I think was in the Civic Center, although I do think they just recently moved to a school district building as well. As I said, we have casework staff that are in each of the school districts in Oakland County. In your packet, I have kind of what we affectionately refer to as the YA Angel, and some additional information that's in your packet that provides some additional information that I may not necessarily cover. But one sheet, I think it's pink possibly, does provide kind of a, after 1953, the school districts caught on to the model, recognized it worked, and then from there over the course of I think about 20, 25 years, each school district put together a program, so there are the list of dates there. But 70 years of service here in Oakland County. So as I said, our mission is to strengthen communities and families, and we do that in two ways. Casework services, community work. Our caseworkers receive referrals from school districts, police departments. Parents can make referrals to our programs. Over the last year, we've seen, actually probably about the last 2 years, I think with the pandemic, an uptick in referrals received from the Oakland County Prosecutor's Office. We have been sort of the depository, if you will, for a lot of the school violence threats. I think that made up about 91 referrals last year that we received. But regardless of the reason for the referral, all individuals, kids, families are going to get the same type of service. And that begins with that initial appointment where our staff meet with families. We conduct an assessment. It's psychosocial educational in nature, really trying to understand not just the reason for the referral, but what are the contributing factors? Why are we seeing this kid in the office? Could be a host of reasons. And often is the case that if there are mitigating factors that are identified, efforts and services are really tailored to address those concerns with the idea that we would likely prevent future reoccurrence of the behavior or the reason for the referral to the program. So you could get referred for school truancy, which does make up a pretty big bulk of the referrals that we get. Prevention-based, retail fraud, assault and battery. Every situation, every family is going to be treated the same. Our staff work to provide, after the assessment, we formulate goals and objectives, and that kind of is the roadmap to which then we decide or how we move forward with our services. Most of our staff have master level education, not required, but most of the staff do have some experience in professional counseling. So we do some short-term counseling, but the goal ideally is to connect those kids and families with community-based resources. With some of the diversion cases that we get, now those are usually those cases that come from the prosecutor's office or come from the local police departments. We're also addressing responsibility and personal accountability. So you do see, there will be some consequences, if you will. We'll offer community service, or we'll create a community service project. One of the favorite things that we used to do when I was a caseworker, actually split between Royal Oak and Clawson, was to collaborate with the local police department. I know you're from Royal Oak. Terry Drinkwine and I would put together a Saturday. I know, see, right?
Right.
I often wonder where he's at or how he's doing, but he and I put together a program for kids to either come in and wash police cars or wash, the fire trucks at local, and it's just a great opportunity to kind of gauge those kids, but holding them accountable, reinforcing making good choices and consequences of behavior. When we see gaps in programs, that's where our community org approach to services kind of come into impact kids and families. A part of what we do as caseworkers, as the professionals assigned to those local offices, is that we work with volunteers. These are generally concerned citizens, professionals. They reside in a particular school district. They may work within that community that have a passion, inclination, a desire to work with kids to make their community better, stronger, healthier, more vibrant, if you will. So our caseworkers work to identify those individuals. They come together, they form what we call our board of directors. We have, from the board of directors, their task essentially is to kind of work with the caseworker to identify those gaps in services. What are the issues, what are the concerns that are impacting kids and families within our own community? Now essentially, there's probably 5 maybe 5, what's what I'm looking for here? 5 programs that are somewhat consistent across the board, but keep in mind, with boards that are charged to really kind of take a look at your own individual communities, what might be available in one community may not necessarily be available in another community. These programs are designed to meet the needs of your individualized communities. But for the most part, family education is a program that our boards work, whether it's a series of classes, Love and Logic, the STEP program. Over the pandemic, we recognized a need, kids really experiencing depression, anxiety, collaborating with community partners or identifying a professional where we would contract with them to provide classes to address those issues or needs. We've worked, in fact, some of the ARPA money has been used to offset some of the costs for those services. We have a Mentors Plus program that we provide youth who could benefit from a caring adult relationship. We facilitate those and we monitor and provide services to those situations. Camp, it's about that time of the year again, we're gonna start talking about camp. We offer not so much the camp itself, we connect with Camp Copacabana, some of the YMCA camps, Camp Oesa. Even at the local level with some of the local parks and recs, our staff and our volunteers will collaborate with those entities to provide day camp opportunities. And essentially, it's providing scholarships for those kids to participate in those activities. And along the same lines, we're also providing scholarships for kids to engage in skill building and recreation opportunities, but with the mindset that kids that are involved and engaged in positive, constructive activities are less likely to make poor choices. Youth recognition, that's that time of year as well, that we're taking the time to honor those sort of unsung heroes in the community, sort of the kids that are not traditionally recognized for, they're not your NHS kids. These are kids that just are doing good deeds because it's the right thing to do. And so our boards and our staff take the time to acknowledge those efforts with the idea, again, that we are encouraging good choices. These kids in communities are modeling positive and positive behavior, good choices, with the idea that we are encouraging others to get involved as well. Just a few facts and figures from last year. Like I said, about $1.4 million combined between the court, municipalities, and school districts put forth in cash and in kind so that we could continue to provide the great work that we do. 19,115 volunteer hours were logged, and according to Independent Sector, the value placed on volunteer hours is $29.95, fun fact to know, but for a grand total of $572,495 worth of service our volunteers have put forth in strengthening families and communities. Last year, we saw 3,144 referrals to our program. Consultative cases, which is sort of what we call information and referral. That might be a family who may not necessarily receive or get involved in casework services, but my family's in crisis, I need a service, can you help connect me with the appropriate resource? That's something that we do and we track as well. And about 20,000 individuals, kids and adults, participated in programs last year. Currently, I've got 1,448 active cases between our 26 offices. Questions?
I want to thank you very much. Youth assistance is near and dear to my heart, and I've been part of youth assistance for many, many years. During COVID with our CARES money and our ARPA money, I've always wanted to invest in youth assistance. We have a mechanism through youth assistance in every single school district to enhance youth assistance to provide additional services for our students in schools. So we have some remaining monies left and one last upcoming meeting to discuss how we want to spend the remaining money. And I would certainly like to see a minimal amount of $250,000 to youth assistance to enhance the programs. And I know youth assistance in the school district does provide services to the children in schools with different groups and activities along with counseling. Commissioner Powell?
For districts that, may come off to not be reporting, like cities, certain school districts, is there any, I guess, I can't think of the word, but like repercussions or anything for those districts who are not reporting? Or you find some negligence in not reporting? Is there anything that you all can do to tackle those type of things, or is that something you have to take up with, I don't know.
I'm not sure I understand
So, okay.
that reporting.
Okay, so
Clarify.
this is my personal feeling. In my district, I'm in the city of Pontiac. So I know that we have some challenges with our school district not properly reporting of cases that is going on in our district. So my question is, if those findings were to become factual, is there anything that you all do in a case like to support that, or, you know what I mean? Like, is there anything, if you all were even to find this out? Because one year, let me say back in 2000, I think it was 19, we had a riot. It was so much stuff going on at the high school. Our middle school is known to have challenges. But again, when I reached out to Pontiac Youth Assistance, you all are not getting the reports of what is going on at the school. I couldn't figure that out. So I was like, well, what, if you all see this stuff going on the news, or you keep constantly hearing Pontiac, like stuff going on, and no reports is really matching for you all to come help these kids, doesn't that alert anything? Or do y'all not pay attention to that type of stuff? Or is that just stuff that y'all really don't kind of engage in right now, you know? So
I can only sort of report out to you what my experience has been.
Okay.
And youth assistance is well received in the Pontiac School District.
Okay.
Tom Swoboda, the caseworker assigned to Pontiac, it's one of the highest referral. We probably get the majority of the referrals, if I had to break down percentage, and I apologize, I don't have those stats in front of me directly. The school district does utilize youth assistance.
Okay.
I can't speak to those incidents where, I don't know if it's the police are involved or they're getting the prosecutor's office involved. I can't speak to that, but I will
Okay.
tell you that youth assistance is being utilized. Kids are benefiting from scholarships to camp, to skill building and recreation. They do participate in youth recognition. Tom is in the building. In fact, at one point, up until just recently when they relocated back to WHRC, he was at the high school.
So is there,
See
so
families.
can I get a request then? I would like to see that data if I'm privy to see that data.
I can provide you the
Yep, I wanna
number of
see every-
referrals that we're getting, absolutely.
Yep, I want to see all that.
Of course.
Thank you.
I can provide that.
Yep.
Thank you. And the stimulus for asking for the presentation here was regarding the news about the Mentors Plus program. So the Mentors Plus program, I understand, is continuing. So I know that satisfies and compliments, and everyone is happy regarding that one.
Winner, winner, chicken dinner.
Yes.
Mhm.
Commissioner Joliet?
Thank you, and congratulations on your 70-year anniversary.
Thank you.
And I would just want to concur with Commissioner Lube's thoughts on the ARPA money to youth assistance, in that I think it's a direct correlation between the pandemic and the youth being the hardest hit, in my opinion, by the pandemic. So I would support that going forward. But thank you for the presentation.
Thank you for having me.
Commissioner Powell?
I just want to say this, though, I am in support of in the youth assistance. I just want to make sure that we are utilizing you all, and you all are
Absolutely.
helping our kids at every avenue, okay? So that's
no,
also just, I know
I
I may have
understand.
came off a different way, but no, I am in support of you. So, and I'm
And
in
I just-
support of what they're asking. I just like to be a little extra in my research and making sure our district is utilizing you
No,
all.
and the relationship is strong
Okay.
there, so.
All right. Okay, thank you.
Thank you. Anything else? And I'd like to thank you for coming, and Pam and Kevin also for being here to support youth assistance.
Well, I appreciate your support, and on behalf of the kids and families that we serve, you know, your dedication and commitment to the program is truly appreciated, so thank you.
Thank you. All right, I need a motion to receive and file the information. So I have a motion by Commissioner Joliet, support from Commissioner Powell. All in favor say aye.
Aye.
Opposed? All right, we have the information from youth assistance, and we're going back to communications. Oh, now we have a quorum. Thank you, people.
Yeah, my bad, I'm sorry. I got caught with
We
some
have
clients at the office.
7 items under communications. Marine Safety Patrol on Oakland County Lakes during the 2022 boating season report. An application exception to the U.S. Department of Justice for the fiscal year 2023 Local Law Enforcement Crime Gun Intelligence Center Integration Initiative. The third is the application exception to the Michigan Department of Health and Human Services for the 2023 Pontiac Integrated Urgent Care. The next is the application to the Michigan Department of State Police for the Public Safety Academy Assistance Program. The fifth is the application to the Michigan State Police for the Hazard Mitigation Emergency Preparedness Program. The next item is the application to the American Automobile Association for the 2023 Traffic Safety Program. And the last item is the January 2023 Intake Disposition Report from our animal shelter. Who would like to make a motion to accept it? Can we have a motion by Commissioner Gershenson and support from Commissioner Powell? All in favor say aye.
Aye.
Opposed? All right, communications are accepted. We move on to our regular agenda. Oh, I need a motion to approve the agenda. We have a motion by Commissioner Joliet, support from Commissioner Powell. All in favor say aye.
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 Opposed? All right, our agenda is approved. Then we move to the sheriff's office. Oh, we need a motion to accept the minutes from February 7th. I have a motion by Commissioner Powell, support from Commissioner Gershenson. Any comments on the minutes? All in favor of approving the minutes, say aye.
Aye.
Opposed? Our minutes are approved. So 3 items under the Sheriff's Office recommendation. The first is an application to the Department of Justice Bureau of Justice Assistance for the fiscal year 2023 Burn Discretionary Community Project. I have a motion. Who would like to have a motion by Commissioner Joliet, support from Commissioner Gershenson? Thank you.
Good morning.
So, Under Sheriff and Guy are here to talk about this item.
So this is a proposal we submitted through Representative Slotkin's office, and we've submitted it a couple of times, and this one looks very promising. So it's to get equipment mostly for the training center and our other locations throughout the county, specifically the jail, but defensive tactics in a MAT training room, physical fitness equipment and officer wellness, firearms training, scenario-based, and then de-escalation and use of force training. So we're hopeful that these funds will come through for our training unit.
Thank you. Any comments or questions regarding that item? Are we voting or all at
I
once?
thought you wanted to do
Okay.
them
All right, next one, acceptance from the Michigan Commission on Law Enforcement Standards, also called MCOS, for the Public Safety Academy Assistance Program.
Oh, make them up. Oh, wait, you're doing them all together.
Yes.
That's right.
We're doing them all, okay. So this is exciting. This is new funding, and what this does will pay for Currently, it pays for our employees to go to the police academy. So historically, we've paid for it ourselves. This is reimbursement to pay for the academy and for their uniforms in the academy. We got a recent email saying that they were changing the breakdown, because at one point you were eligible up to 24,000. This gives us a little over 4,000 for each participant, but they're gonna change the breakdown, so we might be eligible for a little bit more. So hopefully we're gonna come back, and that would cover some of their salaries while they're in the academy, so.
Where's the academy?
Oakland Community College.
Thank you. Our next item is an amendment to Oakland Community Health Network for Medicated Assistance Treatment in Jail Alliance with support at the Oakland County Jail.
Okay, so I think you're all familiar with the MAT program that we have at the jail, and we have an agreement with OCHN to perform those services. Historically, it's just been in-county residents that are eligible, but we have to provide the services to all in-county and out-county, so that's what this amendment does, is expand it to all inmates that are eligible or need this treatment. And so this covers the OCHN performing the services for out-county folks as well.
Thank you. Well, that makes sense.
Yes, it's long overdue. We've been working with Corporation Counsel for a long time, so
Yes.
it's definitely necessary.
All right, any comments or questions on the three items? Commissioner Gershenson?
I just wanted to get clarification, Gaia. You mentioned, is it the training equipment that you got help with the funding from Congresswoman Slotkin?
Yes, that's the application is going through her office.
Okay, so it's not for a training center?
No,
it's for the
it's,
equi-
it's,
okay,
no,
I
it's,
thought,
no,
wait,
it's only
did I miss
410,000,
something?
yeah.
I was reading it over.
No, it's
Got it.
410,000, so it's just
Yeah.
equipment, and then obviously if we move, it's all movable and whatever, and it seems like a lot of money, but obviously we have between 1,400 and 1,500 employees, so, it's not that much with all those people to train and
Yeah, no, I got it.
take care of.
Thank you.
Commissioner Cavell?
Yeah, for the training, this is the training unit is still a roughly $3 million budget unit, right? Lieutenant Workman and
Captain Hill?
Captain Hill, right?
Mhm.
Okay, just wanted to, all right. With the, because it was brought up about the training where the academy is, we just got a presentation from OCC about their expansion of is it called CREST at Auburn Hill? Is that going to be a great thing? Is that big, right? They're going to put millions of dollars into expanding that center and facility for, like, training and law enforcement?
I'm not aware of that. I've not been
Oh,
involved in that, so
okay.
I can't speak to that.
Oh, okay. I wanted to hear your thoughts. All right. And then the last thing with the MAT, this is part of the opiate settlement, right? The funding from this, we got a memo?
That's forthcoming.
Right.
This is just an agreement with OCHN to perform those services. The
Okay.
opioid will be coming.
Okay. So this is not the funding for it?
No.
Correct.
Oh, okay. Can you help me understand that then? Because we got a memo saying there will be funding and an expansion to serve out-county residents for about $480,000, and this is $480,000.
Okay, I don't think, just let me look at the amendments. Because we've been working with Barbara Hinkie. Oh, actually it is, I'm so sorry. Yeah, so
Okay.
this is put in the special fund for opioid settlement, but what
Okay.
we've talked about is expanding in the types of treatment.
Okay.
And injection versus pill and different type of things. But yeah, so this, I'm sorry, it is the
Okay.
opioid settlement. So this is
Okay.
the first step of doing it, but then there's other discussion on how we're going to provide that, so.
And that was my bigger question is, how do you see the opioid settlement and MAT and all these things moving forward? Because we're going to get money to do things like this for a long time, so do you have any thoughts on that, or conversations ongoing and you're not ready to share?
Conversations ongoing with, because obviously it has to do with the medical provider
Yeah.
and OCHN and Corporation Counsel, and we have to make sure all the ducks are in a row, so.
This was the
Okay.
biggest first step for
Okay.
us to avoid any lawsuits of that unequal treatment. Yes.
Gotcha. Okay. Thanks.
Commissioner Woodward?
Yeah, and so what this agreement allows for is because the dollars that were being used, or OCHN was limited to serving residents that fell within their jurisdiction, so this allows for service beyond
Yeah.
that. So that's for people who are listening, that's a clear distinction and that some additional dollars to help afford all of that. I mean, I think this is a big, undertaking. Frankly, the amount of money that, we'll be receiving as part of that settlement, or at least this first bucket of money received from the settlements. It's probably not enough to actually solve the problem, but it's probably worthwhile to, bring some policy experts in the space to this committee to talk about. To start helping flesh out what are some additional ideas. I know our Health Division and Community Corrections and others are looking at things, but if there are other best practices that are not part of those discussions, that public health is definitely a place to do that.
Cool.
Thank you. All right, we prompt the vote on these items from our Sheriff's Department.
It doesn't. That's why I asked.
Yeah.
You have 60 yeas, 0 nays.
All right, motion carries. Thank you.
Thank you.
Our next 4 items are Health and Human Services recommendations. An application with the Michigan Department of Environmental, Great Lakes and Energy Water Resources Division for the Rapid Methods and Microbial Source Tracking for Beaches program. The second is an application to the Michigan Department of Environment, Great Lakes and Energy Water Resource Division for the 23-24 Inland Lake Beach Monitoring Program. The third is a subrecipient agreement between Oakland County and Oakland University. And the last is an amendment to the Michigan Department of Environment, Great Lakes and Energy for the Non-Community Public Water Programs Grant Agreement. Would like to make a motion. We have a motion by Commissioner Joliet, support from Commissioner Gershenson. And we have Leanne Stafford by video to talk about these items.
Good morning, everyone. So I will start with our we call it, a quicker way to say it is QPR testing. This is a pilot program actually we've been doing for 7 years now with looking with EPA to do this, like I said, kind of a pilot test to really look at the source of the contamination in beaches. And so you'll see there's 2 grants. They kind of break them up into beach sampling, which was the second one you mentioned, and this one. And this specifically tries to identify the source of the contamination. So EPA is looking to create a new model where when we're sampling beaches, it's a quicker turnaround. But it takes a significant amount of time and inland beach sampling to do that. So Oakland has been selected as a pilot, like I said, for the last 7 years, obviously with all of our inland beaches. And so we had student sanitarians that come in with us or come in the summer and take these samples, take them to our lab. We do some testing to try to identify it. And then again, that helps us quickly close beaches if necessary. The model in which we do has not changed. So you'll still see there is a little bit of a delay when we have to close a beach, but we're hoping soon, right, we'll be able to continue, getting these samples to EPA and then be able to use the new model. And that's the QPR, QPCR. Wow, it's a mouthful. There is some positions that are tied to that. It's really an oversight, and the majority of that is really based on supplies that we have to use to do that type of testing. Do you want me to ask questions after each one?
So for looking at the source of contamination for beaches in the past, is there been a pattern, or what's the #1 source of contamination?
Well, a lot of people think it's human waste, and generally it's not. It's animal waste. But that's why we're trying to change this model, right, to really look at the percentage. I don't have the data right in front of me, but I can make sure that we get that information to you based on past years.
All right, thank you. Chair Woodward?
Thank you, and thank you, Leanne. When we test, the way that we test for microbials, E. coli, all these types of things at beaches, is this the same type of testing that you would do at a splash pad or other type of aquatic, a park? I just know, just as background, Leanne and her team worked very hard to help get a splash pad in Royal Oak, like opened. I mean, just like it was happening on the weekend, and they did whatever was necessary to get the testing to make it available. But is this the same type of testing that?
So that's like a pool source water, what we would use at a lab. So I think, and again, I'm not the expert in this, but it's a similar type of testing. It's
Okay.
just the qPCR goes further, right? So it looks a little bit further to track the source.
Got
So
it.
could we test that? Yes. That's not the focus of this study. But if you look at all pools that are required to sample on a weekly basis, once they open, and indoor pools, it is the same type of test, yes.
Got it. Okay, thank you.
All right, then the beach monitoring program.
So this is a program that has been running for 40 years, and it's just our beach sampling that we do every year. The state does give us some money to really try or to offset the cost of our sampling. This is a student sanitarians too. We actually have 6 that come in and do our beach sampling. Again, something we've always done, works very well. So students that can come in, we train them, and they also help us with some other programs. And so this helps offset some of that cost there, which we want to continue. Yeah, any questions about beach sampling?
Commissioner Gershenson?
Leanne, approximately how many of our lakes are you sampling a year?
Yeah, let me see if they gave me this. Let's see. You know what? Let me get that back to you. That usually is on here. I want to say that this is, I'll give you a general overview, and then I'll make sure I get the exact numbers to you, Commissioner. But we set every beach to be sampled on a 5-year rotation, right? But those that either have higher use or have had issues in the past get put on an annual rotation, right? So they would be sampled annually.
So,
I don't have the exact numbers, but I can get those to you for sure.
right, I mean, I just remember when we had an initiative to get a volunteer group to come in to help increase the number of beaches that were inspected each year. So that 5-year program has been in effect for a long time. So I'm just wondering if there's any, what would you need to inspect more beaches on a much more regular basis?
So if we were to, you're talking about sampling more frequently, because
Right.
like kind of how the beach program goes, just so you know, they go out, they kind of do an inspection of initially, and then they take samples on a weekly basis. I would need to get back to you. I know we did that study a couple years ago for you all. I can look into that and get that back to you. Sorry, I don't have those details right in front of me.
No problem, thank you.
Commissioner Joliet?
Thank you. I just want to say thank you to what a great program this is. Within my district, I have very many inland lakes, and I know even some of the smallest ones have had some beach closings in the last, 5 years. So I know you guys are out there actively working. And yes, most of the bacteria is from the lovely waterfowl or geese, since the state seems to be putting in, I know this year they're not allowing the geese relocation program, or the goose roundup, as they call it. So it's concerning, and I'm glad that we have this to be on top of it for the safety of swimmers. So thank you.
Thank you. All right, what can you tell us about the agreement between Oakland County and Oakland University?
Yes, so this is kind of a continuation as well. Oakland University has come back to us about a subrecipient to work with them on this produce prescription grant program. And so a little bit about the program, two things. It does involve 2 part-time staff that help us operate this program. And so the program is actually really cool. The participants basically get a prescription from their doctor or someone that would refer them, and they take an online education session with a health educator, and they get a $40 credit to be when they're enrolled in the program, and that can be used at farmers markets and grocery stores for fresh produce. We also do a lot of opportunities in education around physical activity, cooking demonstrations. And so we always are trying to increase our voucher redemption locations. So obviously, we're always building up the farmers markets, and then also our Pontiac grocery stores. So this time we're also expanding into the southeast part of the county. So great program. So glad that Oakland U has come back and asked us to partner with them on this program.
Thank you. I like the idea of partnering with farmers markets. I'll keep that in mind. All right, last item.
So the last item is an additional funds for our Type 2 non-community program. And so the non-community program is any type of facility that serves the public, right, that has a well. So there's still a significant, I want to say we have just right at 800 supplies in Oakland County. And so the Eagle provided additional funding actually for all agencies across the state to be able to do additional work. So it's not just for the what we do right now. We go out and we inspect every wellhead and the piping inside once every 5 years. But this is to increase even education on the importance of sampling, right? So putting people out in the field to meet with these individuals periodically to help take water samples. Currently, you heard a lot about this through lead when people started taking additional lead samples in the communities, and we started having to do boil water. And this is very similar. So facilities are required to sample certain types of samples, bacteria, VOCs, lead and copper. And so what this allows us to do is put people in the field working directly in the communities to help them understand the importance of that, how to properly take samples. And so we'll be hiring staff to go in and actually be able to assist with the program.
Thank you. Any questions regarding this? Any, Commissioner Cavell?
Yeah, this isn't about any of those, but in the sorry, Leanne. In the communications, though, was a $5 million grant application to the Pontiac Urgent Care. Can you tell us a little bit more about that? It just sounds like a big number.
That grant was actually, we received $5 million from Michigan Department of Health and Human Services, and that is to develop and open an integrated urgent care. And so in Pontiac, specifically for this initiative. And so we are working with Honor Community Health, with OCHN, as well as the hospitals in Pontiac to create this integrated whole person urgent care. So what our goal is, and we're still really working through the operations, is that when someone comes in the door, they will receive an assessment of primary care, behavioral health. And so at that point, there will be opportunities, obviously, to receive the primary care. You go into an urgent care, you have a fever, right? Whatever that is, they can receive that. But we also want to have that behavioral health urgent care resource available on site. So if somebody needs medication or assistance or some kind of crisis support, we would have people right there to be able to do it. So it's a very innovative model. There's not a lot in Michigan. You see some in the country, but we're really excited about this opportunity and hope when it works well, we'll be able to do it in other areas in the county. So.
Cool. Okay. Thanks.
Thank you. Anything else? All right, prompt the vote, please.
You have 6 yeas, 0 nays.
Motion carries. Thank you, Leanne.
Thank you.
Our last scheduled item on the agenda is an acceptance from the State Court Administrative Office for the fiscal year 2023 virtual backlog response docket program. And this is a circuit court recommendation. Who would like to make a motion? I have a motion by Commissioner Joliet, support from Commissioner Powell. And welcome to talk about this item. Thank you.
Well, thank you. Good morning, Commissioner. Good, I guess it's still good morning. Thank you for placing this item on your agenda, especially given the fact that there was such short advance notice. I think it was just last week that we received notice from SCALE that they were going to provide funds for us to help reduce criminal backlogs. The pandemic, as you can imagine, affected a lot of trial courts in the state of Michigan, and although we did experience a backlog in criminal cases, did quite well in some of the other cases through civil, domestic, and so forth. But because of our inability for many, many months to try cases, to have jury trials, the number of criminal cases swelled a bit, but so did especially the large volume courts. I've talked to the court administrators, Wayne, Kent, Macomb, and they've all experienced the same thing. So, but it's not dramatically higher, but it's higher than it was going into the pandemic. And so we started doing jury trials in earnest last June, and the judges are really cranking out the trials. My chief judge would be here, but he's in the middle of in fact, he and I spoke last night, his oldest criminal case. It's involving an improper defendant who is representing himself, and he's been incarcerated for a while, and that case is ongoing right now. So SCALE told us that back in October that funds would likely be available to help trial courts manage their pending, their backlog, their criminal case backlog. One of the provisos of the funds, though, is that there had to be a virtual component tied to whatever method we use to try to reduce our criminal backlog. Well, the judges will tell you, those who handle the criminal docket, that the criminal cases do not lend themselves well to the virtual environment, not nearly as well as, say, a civil case would. There were experiments tried during the height of the pandemic on trying holding jury trials via Zoom or some virtual environment, and it did not go well. And one of our judges was even on a committee to study that, and he reported back to his colleague that it was just not something that was doable. The defendant has a right to confront his or her accuser. There's evidence that is distributed, during criminal jury trials and other things that just make the virtual environment very awkward for that. So when we were told by SCALE that there would be funds available for reducing our criminal backlog, but there had to be a virtual component, we're like scratching our heads, well, how do we make this happen when the virtual environment does not lend itself well to handling criminal cases? So we remembered about 20 years ago, we did something called an intensive civil case settlement week, where we just dedicated a week, and we had about 500 cases put into that week-long settlement program. We had about 40 attorneys who volunteered their time, and they met with parties. We called all the parties in, and months in advance. We told them you had to appear on this date. The mediators met with them and just churned through trying to resolve cases through settlements. And then we had a couple of judges waiting in the wings when settlements were achieved, and we marched the parties right down to court, and they entered their settlement on the record. And we disposed of about 80% of the cases that we put into that settlement week. So we thought, well, maybe we could do the same thing. We could make that a virtual process where mediators are meeting virtually with parties in a case. And although it's not addressing the criminal backlog, if our judges have a civil and a criminal docket, 11 of our judges do. And so the thought is that if we could have a method by which to resolve very quickly a lot of civil cases, that would give the judges more time to focus on their criminal docket, and particularly those involving in custody defendants, although not exclusively in custody defendants. And we shared that idea with SCALE, and they loved it, and they said, yep, that'll work. And but then we didn't hear anything from them for the longest time. I think it was November that I sent an email to our SCALE regional administrator, kind of talking in concept about this program, and she thought it was a good idea. My chief judge has reached out to the Oakland County Bar Association, and although he told me last night he wants to have more discussions with them, but conceptually they agree with this, and they're going to help try to provide members of their association to perform these mediator roles. And so we're kind of thinking second quarter or third quarter, sometime maybe in the summer, that, because there's a lot of planning that has to do, as you can imagine, just getting these cases identified, those that would be ripe for this kind of a settlement environment, and then notifying them. Usually you want to give them at least a couple of months' notice that they have to appear so that they can make all the necessary arrangements to be here. So that's kind of the plan. And then SCAO notified us last week. We kind of knew it was coming, but we didn't know when. And they notified us that we're getting, it's an odd number, $700,650, which is kind of an odd number. But they're making that available to us. But then the thing that really threw us for a loop is they told us that we had to have the grant acceptance and the grant contract signed by March 31. So I reached out to Patty and your staff, and she was tremendous. She said, Kevin, here's what you need to do. We'll get it before the commissioners. And so I really want to thank her for her assistance. And so that's why we're here today, is to ask the board to approve accepting those funds. And then I would imagine this will probably, I would assume, go to your finance committee as well as to the board, full board, so.
Thank you.
Yeah.
We do love to accept funds. Any other, Commissioner Gershenson?
Sounds great. Could you introduce the?
Oh, yes, I apologize.
Hi.
Oh, Chris.
Chris Bujak, who manages our civil criminal division, my apology for that, and.
I manage the court business division.
Business division. And Pam Monville just left. I think she had to run up and meet with the judge at noon. She's our deputy court administrator, and of course you know Liz from her previous.
Okay,
So
thank
my
you.
apologies, Commissioner, I should have done that right. Yes.
Anything else? All right, prompt the vote, please.
You have 6 yeas, 0 nays.
Motion carries. Thank you.
Thank you so much, appreciate it. Thank
Nice
you.
meeting you. Thanks for coming.
Thank you. Nice to meet you.
All right, we've arrived at public comment. Is there anyone from the public wishing to comment? All right, public comment is closed, and I will declare the public health and safety meeting adjourned at 11:59. Thanks, everybody.